Hello, good afternoon. My name is Dr. Chudi of Snowspirations Global Health Solutions. And today is such an amazing day to talk about this topic. Today, we're going to look at the possibility of having a heart episode during watching any sports game out there. Can watching a soccer game, can watching a basketball game, can watching a football game trigger heart attack, which can lead to death in some people? So that's what we're going to look at today. And I wanted to take this very serious because there are so many sports events going on, especially tomorrow. So tomorrow we have three major sports events. And previously, we had the news of people dying just shortly after watching a penalty shootout in a soccer game. And to some people, it might sound like, why didn't this guy do this? Why didn't this guy do that? There are so many layers to things that kill people. Death, it's something that can happen anytime. But there are certain things we have to equip ourselves with so we can do our own part. There are certain preventive measures you can address, you can use, so you can beat more time, so you can buy more time. So the question is, can watching a soccer game, can watching a football game, can watching a Super Bowl tomorrow, or basketball, or whatever team you love? Like for me, tomorrow I have three major sports events. I have my darling club Arsenal playing tomorrow. I have the game between Nigeria and Cote d'Ivoire tomorrow, the finals. Then I have Super Bowl in America. So three major events tomorrow. Now the question is, can putting a lot of pressure, can allowing myself to veer off from tension lead to some hard episodes while watching all these soccer games, while watching the basketball or the Super Bowl? What's the answer? Yes. Your heart is very, very fragile. There are certain things you need to be conversant with. Now, watching the soccer game, watching the Super Bowl, or watching your darling club directly might not kill you, might not lead to heart attack, might not lead to heart failure, but prior lifestyle, current situation, things you might have done differently, or things you could have done in a way or you didn't do, can all contribute to having a heart episode. For example, there are so many people that have undiagnosed medical problems. There are so many people that have undiagnosed hypertension, undiagnosed diabetes, undiagnosed cholesterol problems. There are some people that are struggling with their body weight. There are some people that have very terrible heart conditions, but we haven't even diagnosed them. There are some people that have holes in their hearts. There are some people that have congenital problems, congenital heart problems. So you remember when some players will be playing soccer and they will suddenly die? I remember in the 80s, one Sam Okwaraji, while playing for Nigeria, suddenly collapsed and died. And the fastest and the quickest thing to, blame it on, it's jazz. So for people from developing countries who will quickly, believe that someone in the village gives someone, jazz, and they use remote control to kill that person. It's not true. Sam Okwaraji did not die from remote control. The people that died watching soccer did not die because someone in the village killed them. They died because they probably have undiagnosed, ongoing heart problems, ongoing hypertension, and a couple of other things which were poorly managed. Now, there are differences between someone that is very active, someone that is used to putting a lot of stress on the heart, and someone that is not used to that situation. Now, when we tell you to modify your lifestyle, if you are someone that is pretty much active, so you exercise pretty much regularly, you eat good food, you sleep, you don't smoke, you watch what you eat, you're not stressing too much, the possibility you can shout and have all the tensions and still survive is very, very high. But if you live a sedentary life, You wake up in the morning, you're from your bed to your couch to your car. You don't exercise. You don't go for work. You don't do nothing. You eat anything that comes your way. Possibility you can have a heart attack. Possibility you can have what we call myocardial infarction or heart failure, and you can die in resource-poor country is very high. So directly, watching a soccer game will not kill you. Watching a soccer game will not be the things that will kill you. It's your current medical situation. It's your current ability to mitigate what can happen. For example, if you are planning to watch the game tomorrow and you have regular medications you're supposed to take, please take them. If you are already diabetic, if you are already hypertensive, or you have a regular medication we gave you, cholesterol medication, or you're on baby aspirin, please make sure you take them before the game. It's not about, oh, go easy, don't go easy. We are people of emotions. Emotions can go high and up, even way more than people that are playing that soccer. And when you're expressing your emotions, it can put a lot of stress on the heart. When your heart is no longer able to perform optimally, when your heart dies or your heart fails, you're going to die. What happens is people that have stroke, people that have heart attack, people that have heart failure, they might not have enough capacity to return blood back and forth to the heart. And when that happens, you will not have enough oxygen in your body and you will practically die. So there are some precautionary measures you can take for tomorrow's game. So if you're an Arsenal fan like me, you know, we have a lot of, you know, emotions. We've gone through a lot, but we're still standing. Why are we still standing? You have to devise a means of adjusting. You have to understand that this is a game. Soccer is a game. Super Bowl is a game. Basketball is a game. Win or lose, live to tell the story. So a couple of things you need to do tomorrow if you're watching any of those games. Make sure you get enough sleep. Very, very important. If you are on any medications, especially antihypertensives, anti-diabetics, or cholesterol medications, please make sure you take them religiously. Don't miss any one. Missing any of them can put you in danger. Now, if you notice that your body is feeling somehow, you are having a fainting spell, your heart is racing. During soccer, the heart rate can increase up to 75% when you're watching through the telly, or up to 110% when you're there watching live. Your heart rate can go up. When your heart rate is going up and your heart is not in a good place to mitigate the impression and the stress from the increased heart rate, your heart will fail. When your heart fails, you're gone. So make sure you take all those antihypertensive medications. Make sure you take your routine, multivitamins. Make sure you drink a lot of water. Make sure you sleep. Now, if you notice, when we watch soccer, there are certain habits we adopt. During soccer, some people will be watching soccer and drinking beer. Some people will be watching soccer and smoking. Some people will be watching soccer and eating junks. Combination of drinking beer and other alcohol, smoking and eating junks, sitting in one place is already creating dangers for you. But if you're someone that is up and about, if you're someone that is constantly moving, you exercise, you run, you do this, you're constantly in motion, even if you want, shout up and down, you will still be alive. So it's your lifestyle that can know if you can survive a trigger. Now, the people that likely died during that penalty shootout would have died, maybe a few months down the lane. It's just that the penalty shootout happened to be the catalyst that actually facilitated something that would have still happened. So unfortunately, the people that died during that soccer game, the penalty shootout was the catalyst. It was the trigger. But if they had continued in their same lifestyle without exercising, continue smoking, continue stressing, not drinking water, drinking alcohol, smoking, eating junks, that heart attack will still happen down the lane. So we need to be careful. We need to think more about our lifestyle. Our lifestyle is the biggest predictor of cardiac events. Our lifestyle can either help us or harm us. When you are smoking, you are knocking on the door of so many problems to come and kill you. When you are drinking a lot of alcohol, you're doing the same thing. When you are not getting enough sleep, like most people that are fanatics, like most people are sports fanatics, some people put a lot of money, some people bet, some people use it, some people attach a lot of emotions, some people fight, some people quarrel, some people argue. All those things can put a lot of stress in your heart and it can kill you. Thankfully, it's preventable. So there are a couple of things you can do by yourself. There are a couple of precautionary measures you can take. There are some people that have had heart attack in the past. If you have had any cardiac episode in the past, if you have survived heart attack in the past, personally, if you ask me, you can follow the commentaries, you can follow the scores, but be careful if you have a predisposing factor to having a repeat heart attack, a repeat heart failure, or if you are already compromised, please be careful. Personally, if it's possible, avoid the games. Because if you have a trigger, possibility you might not make it is very high. So yes, watching soccer can elicit pressure, stressors, which can put a lot of load in your heart, and your heart can fail. You can have a heart attack. You can have other complications. And unfortunately, some people might not even know they have this. If you are in developed countries and you go for your routine medical checkups, we can find something out. We can begin to follow you up. We can begin to send you to the cardiologist. But if you live in developing countries where even if you have an emergency, so no one will come to your rescue, you are as much as good to go. So know the environment where you live, know the society where you live, and modify yourself. So moving forward, I'm going to give you practical tips. Have a free will, free mind when you're watching all this game. Don't go attaching a lot of importance or sentiments. Win, lose, or whatever, it's okay. Don't go arguing. Don't go fighting. Please ambulate. Please stay active. Don't sit in one place throughout that whole game. Try and move around. Hang around genuine people. Hang around matured people. Don't go in a place where they will easily fight and do all those stuff, and before you know it, you have an episode. Of course, no smoking, no alcohol. I know it's very tough for some people because some people have stocked their houses with beer, with all those alcohol out there, with so many junk foods, which it's what people do when they are watching soccer and watching games. I understand that. But we are talking about living to tell the story. So no smoking, limit your alcohol, possibly stop. You know yourselves, definitely get some good rest. You have to get some good rest. When you rest properly, possibility you're going to have cardiac episodes is limited. So you can still watch your soccer and you can still live to tell us about the scores, who won and who lost. If you take good care of yourself, refuse to be a statistic. You can still live to tell us about the games. The 3 important games tomorrow, you can watch them wisely. I don't want it to be a statistic. And the funny thing is, there is no boundary in cardiac episode. Anybody can have heart attack. Anybody can have heart failure. Anybody can have sudden death. Anybody. Kids, adults, people that even look after themselves. It can happen anytime. The only thing that will save you is good hospital facility, good first aid facility. So if you live in countries where you don't have all this facility, you are in danger. I'm just keeping it real because even in America here, there are certain things that when it happens, if you don't get to the hospital immediately, you are going to go. So refuse to go. Apply precautionary measures. Know your own individual health. For example, if you're currently hypertensive, make sure you take your medications regularly. Make sure you know how to check your blood pressure. If you're diabetic, the same thing. Now, depending on your life indices, there are some medical conditions that work hand in hand. For example, majority of people that have hypertension will also have diabetes. Now, majority of people that have hypertension and diabetes will also have high BMI. Now, when you have a combination of high BMI, your BMI stands for body mass index. Your BMI is calculated with your body weight and your height. So when your BMI is above 25, you have overweight. When your BMI is in the 30s and above, you have obesity. Overweight and obesity is a medical problem. Now, when you have a combination of high BMI, diabetes, hypertension, smoking, drinking alcohol, not getting enough sleep, you are a ticking time bomb. You can go anytime. You have to be careful. Managing one of those medical problems is already stressful. So managing hypertension by itself is already stressful. And the reason why what you will eat matters. When you watch all this soccer, you eat your fries, you eat your cake, you eat all those stuff that contain high fats, what's going to happen? They contain a lot of salt. Your body retains a lot of fluid. Those salts will start attracting a lot of water to your body. The water can overwhelm the heart can fail, and you can have problems. So what you eat when you're watching the soccer game is also important. So be careful. What I'm telling you today might be the missing link that will still keep you alive. I just took time. I have to think outside the infertility spectrum to bring out this topic because I know, unfortunately, after the last game we played with South Africa, unfortunately, some people died. Even a medical doctor was among the people that died. And so many people were talking about how the guy died, what he could have done differently, this, that. There are so many things you don't know. When death comes, it comes, you know. So the question is, what can you do right now? Since you have an opportunity to hear my voice today, how are you going to modify your life? How are you going to modify your approach? I know some people will not watch this video because they will feel, oh, who is this guy? What does he know? I'm just trying to help. Protect yourself. Protect your heart. Live to tell the story, especially if you have started your family. Think about what will happen to your family if you're not here. Think about how your life will change, how the life of your family will change if you're gone before your time. So be careful and live to tell the story. Live to watch another game. So thank you so much. That's my presentation. I'm going to give you an opportunity to ask me questions. So I can see Chinyere already on the floor. So Chinyere, can you ask your questions? I think there are two other people watching the video. I'm going to share the screen. I'm going to share my transcript, and hopefully it's going to help someone out there. Remember, we have a big event this February. February is for multiple pregnancy. So if you've always loved to have twins, triplets, quadruplets, February might be an opportunity for you because we are organizing multiple pregnancy masterclass. Multiple pregnancy masterclass will equip you with the knowledge, with the secrets that might aid you to be a twin mother, a triplet mother, a quadruplet mother. It's possible you can have twins, triplets, and quadruplets in 2024. Registration for that event is currently open. It's going to be on the 25th of February, 9 p.m. Nigerian time. Right now, please start asking questions. Okay, Chinyere, what can people around a person having heart attack do to help? Now, this is a very important question. Now, ordinarily, in resource-rich areas, in resource very highly sophisticated society, there are first aid kits in close proximities, virtually everywhere. So there are standard things people can do. There are standard approach. There is something we call CPR, cardiopulmonary resuscitation, which people can learn how to administer to people, especially if someone is having a heart episode. Now, what we need more for layman is to think about ABC. We think about the airway. We think about the breathing and the circulation of that person. Unfortunately, when such thing happens, people tend to, rally, people tend to flood that place, and the person that is actually trying to live is not getting enough air, probably there is poor ventilation. So the most important thing in intervention, in trying to save someone that is about dying, is to think about ABC. Airways, breathing, and circulation. So you can actually stay with that person and make sure that person, if the person is wearing a tight-fitting cloth, you can tear the cloth out. You can make sure there's enough room for the person to breathe. If you know how to administer CPR, you can immediately begin to administer CPR while you're calling for help. If help can come immediately, they can resuscitate that person, take the person to the hospital, and that person might have a chance to live. There's actually some drugs we can give you immediately to resuscitate your heart if we arrive there on time. But before then, CPR, cardiopulmonary resuscitation. Now, to your layman knowledge, if you happen to be there when someone collapsed, when someone is having a stroke, when someone is having a heart attack, make sure there is room for that person to breathe. Don't go suffocating the person. Some people will not even help. They will use their pictures and recording to make it go viral, to make it be like that. The first people that announced the tragedy. We can still save those people by giving them CPR, by making sure they're actually breathing, by calling for help, by staying there and encouraging them. Someone that slumps, depending on how that person fell, can actually also sustain some injury. So if the person falls on the head, the person can also bleed internally. So the biggest thing you can do, you can begin the ABC I mentioned, and you can begin to call for help, because once the health personnel are on ground, they can save that person from dying. I love that question. Is heart attack passed through genes? Yes. So whatever happens in your family can be familial. So there are some heart conditions that can be transferred from your mom, your dad to you. For example, hypertension can be familial, diabetes can be familial, some heart conditions can be familial. Like if your daddy had a heart attack or heart failure, possibility you're going to have it is very high, especially if your lifestyle is not in tandem with protecting yourself. If your daddy had hypertension, if your mom had diabetes, the possibility you're going to have it is very high, especially if your lifestyle is not a healthy lifestyle. You can actually have it earlier than later if it's in your family. So yes, heart problems, diabetes, hypertension, cholesterol problems can be familial. So it can be genetically determined. Yes. Okay, do we have any other questions? So what I promise, I'm going to make this particular video public. So I'm going to share it extensively. So I don't want any news that someone died from watching soccer tomorrow. If it's something that God has already ordained to happen, it's going to happen, it's going to happen. But the ones we can prevent, please, let's prevent them. Be very careful the company you keep. If the place you're going to go to watch that soccer is a place they will be smoking, they will be drinking, they will be eating all those nkwobi, avoid them. You can even avoid the game. If you know your heart is so fragile that you can't take all those tension, then avoid the game. Trust me, there won't be any change. Thankfully, in America, the time they normally play all those games are the time we will stay at work. So if you have to keep yourself busy and they will tell you the score later, please do that. Don't go dying for something you can actually avoid. Very important, okay? My good friend, Dr. Suji, will you recommend aspirin prior to the game? Yes, I will recommend aspirin prior to the game if you have a risk factor. So there are some people ordinarily we will recommend baby aspirin for based on their medical history currently. So if you're in that category, yes, but please don't go taking aspirin by yourself if you are not in the category of people that have risk factors. Medications and drugs are not things you play with. So aspirin is like fire. Aspirin can help you in a couple of other. There are so many things aspirin can do. Aspirin can actually prevent heart attack in people that have predisposition to having heart attack. And in some medical situations like pregnancy, we can prescribe aspirin for pregnant women based on the presenting complaint, based on the medical condition of that person. So if you know you have a predisposing factor and your doctor prescribe baby aspirin for you, please take it before the game. But what you can do, if you know you are on any drug, and please possibly eat, don't go watching that soccer on an empty stomach. If you are hypoglycemic and you raise all those catecholamines, all those adrenaline, if they go up, you can die faster compared to someone that has food in the system. Of course, stay with fluids. Personally, I know it will be tough to tell people not to drink alcohol. I know. But remember that alcohol can lead to dehydration. So when you're drinking alcohol, alcohol and smoking are brothers and sisters. So majority of people that drink alcohol will want to smoke. And when majority of people that drink alcohol and smoke will want to eat all those junks, fries and chicken, beef, pork, and all those stuff. They are the things that will catalyze your death if you can avoid them. Trust me on this. Okay, is there any food one can take to control heart rate while watching? So you can't go wrong with your fruits and vegetables, can you? You can't go wrong. You can't go wrong with your water. So you can stick with your water. You can do your fruits. You can do your vegetables. And you can still watch the game. Or you can just do all this stuff before the game. Because the problem is, there are so many things that can happen to your metabolic process in millisecond, and if the body can't handle it, you're gonna go. So you can actually be eating while the game is going on, and you can aspirate what you're eating. So there are certain things you should be conversant with and avoid. Personally, I will tell you to finish eating before starting any of those games. I love the questions. They are very technically applied everyday questions. So if you have more questions, please ask. I wanna commend Dr. Suji for attending. Dr. Suji is a very good friend and is someone that believes so much in the community. And I'm sure tomorrow, Dr. Suji will also be watching the Super Bowl and the game between Nigeria and Cote d'Ivoire. And Dr. Suji will still be around to tell the story of who won and who lost the game. Whatever happens, whoever won the game or lost the game, it doesn't matter. I just want to see you around tomorrow, okay? All right. Do we have any other questions? I'm not surprised the clinic was poorly attended because, it's not really a hot cake, but, the things people should be going for, they don't go for it until something happens. But please, if you have access to this video, make sure this video goes viral. Share this video extensively so that the people that need the message will use the message to apply the message so they can still be around our loved ones. So make sure you copy this video, put it on your networks. Make sure this video goes viral so that this video can help someone to still live again tomorrow. Thank you so much. And before you leave today, please make sure you subscribe to this channel. And when you're done subscribing to the channel, click your notifications so they will tell you when I'm likely gonna come live. My clinics are weekends, Saturdays. So every Saturday about this time, you will see me talking about the topics I love talking about. So I hope to see you guys next Saturday. We'll pick another topic and we continue the conversation. Now, if you're in our Facebook group and pages, there are so many beautiful things happening there. We recently developed a fertility optimization program. We understand that so many of our members are having problems becoming pregnant. So we developed a comprehensive guide, an optimization program that will help you and your partner to start your family. Make sure you grab a copy of that particular document. We also have our regular consultation packages, especially for people in Nigeria. So if you decide to consult with me for 1 week, for 1 month, for 3 months, for 6 months. If you're currently pregnant, we want to walk that walk with you until your baby is born. Now, if you're not resident in Nigeria, you can also participate in the masterclass. The masterclass for February is going to be on multiple pregnancy. So there is absolutely no excuse. There is no reason why you are not going to overcome in the month of February. So thank you guys so much for coming. Would you advise another good friend of mine, Matthew? Matthew is a top-notch pharmacist here in Tampa, Florida, a good guy any given day, someone that loves actually giving back to the community. So will you advise people to take some anxiety medications before watching the game? I'm not surprised Matthew is asking this because this is his jurisdiction. So here's the deal. If you were prescribed anxiolytis, if you were prescribed anti-anxiety medications, take them. What I will not advise you to do is to take it by yourself. I do not subscribe to self-medication. I'm a proponent of running everything by your provider. So you can actually ring your provider today You can actually ring, this is era of, quick access to providers. If you have access to providers, you can actually tell your provider, hey, I'm having anxiety. I don't know if I can handle the game tomorrow, but I'm really interested in this game. Then your provider can okay whatever anti-anxiety drugs you can take. Or if you were already prescribed those anxiety drugs, then you can take them. But if you were not prescribed the anxiety drugs, please don't take them. You see, drugs are like fire. Fire can help you cook your food. But if you are not careful, fire can burn your house. So run everything by your doctor. Thankfully, there are some providers that are around the corner 24 hours. They can check your vital signs. They can check your medical history. Then they can tell you to take this drug or don't take this drug. The best way to avoid problems is not to start the problems from the start. So just like the question Dr. Chudi asked regarding aspirin, baby aspirin, your doctor has to certify that you can take the baby aspirin if you have a risk factor of throwing an embolus. The same thing is applicable to this same question that Matthew asked. If you have anxiety problems, anxiety can kill. There are some people that might not even know they have anxiety problems. There are some people that can have a combination of hypertension, diabetes, anxiety, depression, all combined. And you will see them every day. They might have the whole money in the world, but they are ticking time bomb. So you know yourself. You know when something is wrong. There are some people that have already started having insomnia because of this game. There are some people that have been drinking since. There are some people that will start drinking from today to that game tomorrow. So by the time the game is coming up, they are already filled with a lot of toxins in their body, which can easily set up a cascade and they can easily die. The triple things that people normally do when they are watching games is what? They eat a lot of junk foods, especially fries, chicken, turkey, and all that. Then they drink a lot of alcohol. And some people smoke. And when they are doing all these things, they are sitting in one place. Sedentary lifestyle. Sitting is the new smoking. If you are not careful, sitting can kill you faster than smoking. So be careful. I love all these questions. Yeah, good question from Matthew. So I know Dr. Chudi and Matthew will definitely clutch on possibility of taking some anxiety meds, but both of them can actually prescribe for you, okay? So if you happen to have Dr. Chudi and Dr. Ekechi, my good friend, my two good friends, if you happen to have them in your jurisdiction, both of them can actually prescribe and monitor you so that if you start having, adverse effects or, in any other conditions, they can easily apply precautionary measures. But if you don't have any provider that can, the anxiety medications or your aspirin, please don't take it. You're taking a big risk. Thank you guys so much. I really, really enjoyed this particular clinic, and I hope to see you guys again. Please copy the link for this video. Share it with all our people. I know some people might not really have the right information, and they might think they're doing the right things. I know we don't pay attention to important things. We always wait for breaking news. We are gonna be the first people that will carry the death of people out there without knowing that our own death is looming around the corner. Refuse to die. When you die, you become a statistic. Look, I'm telling you, no matter how careful you are, when you're gone, you're gone. So think about your own life. When you're carrying other people's news, have you taken the precautionary measures? Have you been exercising? Have you been sleeping properly? Have you been drinking water? When was the last time you went for your well woman check? When was the last time you went for your wellness check as a man? Like in Nigeria, men brag that they haven't gone to the doctors for a long time. It's a bragging right. You haven't seen the doctor for 10 years and you think you're healthy. You are not healthy. You're a ticking time bomb. You're just waiting to die. Not seeing your doctor for a long time is not a mark of excellence. It's actually a mark of ignorance. You are supposed to see your doctor regularly every year. It's not just women that go for their wellness check. So do the right things. Do the simple things. The problem is we don't normally do the simple things. We want to go do the complex things because we avoid doing the simple things. Then when simple things become complex, we begin to run helter-skelter. We begin to look for quick solutions. There are no quick fixes in health. Simple things like taking your multivitamins can augment the things you're not getting from your food. especially for women that want to start their families. Simple things like taking your normal folic acid can help you to prevent neural tube disorders. So let's not think about buying drugs that will treat a particular infection. Let's think about things we can do so we will not have a need to take any drugs. Sitting is the new smoking. Sitting can kill you faster than smoking. Sitting is deadly. Sitting syndrome is deadly. You have to get up and move. Whatever happens, whichever environment, you have to move. If you are not moving, you are getting ready to die. You have to move any which way. Okay? All right. Thank you guys so much. I truly enjoyed this particular presentation, especially I want to commend Dr. Suji and Dr. Ikechi for attending, and of course, my moderator, Chinyere. Thank you so much for making it fun. I hope to see you guys next Saturday. Until I see you, God bless you and enjoy the rest of the evening. And tomorrow, whatever happens, happens in the Super Bowl. Whatever happens, happens in Arsenal and Nigerian game. It's okay. They win, they lose. It doesn't matter. I want to see you next Saturday. God bless you and bye-bye.